basis of our whole foundation, the way it was formed, I just wanted to give you the principles that this has been built upon. One is that we also, whatever the needs are there of the people, the strongest needs in India, or what is actually somewhere our passion to or interest in, that's those areas that we look at. And therefore, we looked at, in the beginning, education, health, as well as in providing clean drinking water. So these were the three focus areas for the foundation. In addition to this, uh, what our other basic thing is that we want to actually, we believe that any change in India has to be done by the private sector first, because the traditional methods or the traditional ways of solving the problems of the country have got us this far, but not far enough in the last 75 years. So you need to do innovation to find out new solutions, and innovation can only happen in the private sector with private foundations, private institutions, because by definition, innovation also means that there will be risk and there will be mistakes. And you cannot expect a government servant to make a mistake and not get pulled up by some agency or the other. So you have to do innovation. Second thing is that you have to do innovation in scale. It's also very important that you do it on scale, because if you do it in 1,000, 2,000, 5,000 people, you can't move it in the country where there are 1.3 billion people, and you need to have credibility also. Second thing important, so innovation is one, second is scale, and for scale to be really for anybody to work at scale, you have to work in partnership with government. Because if you are not in partnership with government, it is impossible. The complexity of the country, the large spread of the country, you cannot do it. And finally, you need to have people who are working with you who have a passion for this and who are doing it not like a job, but much more as a job. And they must have what we call the seva bhav, or the service orientation. And unless they have that, you cannot be successful. So it is on these bases that we form the foundation and the areas we selected. So with that as a basis, keeping in mind that you have to partner with government, keeping in mind that you have to do on scale and do innovation, when the Prime Minister in 2018 announced the aspirational districts, that's when actually Niti Aayog reached out to us and said, looking at the work that we've done in the past in all these areas, in several states, in partnership with government, that they also wanted us to get involved in it. So in the beginning, we took 26 districts and looked at two areas of focus for us. One was education and the other was health. Formed 60% of the work that was to be done for the aspirational districts. The aspirational districts, as you are well aware, are those districts which frankly are the most, let's say, underdeveloped as far as any social development goals are concerned. And if the country has to go ahead and meet these targets by 2030, if these don't work out in these districts, then we would be far behind. So that was the thinking behind why Prime Minister wanted to give focus to it. And that's where we also started working. So we worked in 26 districts first, in education and in health. I'm very happy to say that there has been independent appraisal done of the work that has been done by all the foundations. So first of all, we put almost 750 people on the field in these areas, in these districts, which are really backward districts. I mean, I can tell you that there are districts where you will find that in, let's say in Assam, you would find that for months during the monsoon season, the whole, like islands who get they would become islands, pieces of land would get separated from the main this thing. To move from one place to the other, to go to school for a child could take 3-4 hours at least at one trip. So 8 hours you would spend. You wouldn't get, the government would be absent in a lot of places, etc., etc. So anyway, we worked there. We put 750 of our own people in these districts. We had another 250 plus at the headquarters managing things. And I'm happy that there was a study done by the Institute for Competitiveness, which is an affiliate of the Harvard Business School. And they said that out of all the districts, 4 of the top 5 districts in terms of education were the districts where we had worked upon.
Wow.
And in health, 3 of the top 10 districts where the most improvement was done were also worked upon by us. So, for instance, in education, we worked in Jaisalmer, Balrampur, Sonbhadra, and Singrauli. These were the 4 districts which were amongst the top 5. And in terms of health, Balrampur, Sheikhpura, and Barwani. So these are the type of work was doing. Worked with local NGOs, worked with the district magistrates, and started in April 2020, we launched a new program called the Surakshit Dada Dadi Nana Nani program. The idea was that older people in these rural areas, many of them are alone because their children would have moved into urban areas to make a living, and these people are feeling very lonely. They did not have access to information. They did not have access to even, frankly, talking to people. That's when we set up this Surakshit Dada Dadi Nana Nani campaign. We collaborated with 150 local NGOs and raised 140,000 volunteers. And these volunteers, they are all from that district alone. They reached out to the 29 lakh senior citizens during this period and addressed their grievances, their issues, and made a difference. So this was in 2020. Now, after the second wave in 2021, we were asked to do even more. So first, whereas we worked with only 26 districts, now we are working with 112 districts. And there it is, we are partnering just like we did 150 NGOs, or the local, hyper-local, I would say, now working with 1,000 NGOs, hyper-local NGOs. And we want to get several more volunteers in the 1143 blocks, which are there in the 112 aspirational districts. So that's a bit of a long talk on what we are doing. Talk about a little bit of that as well, but the intervention, I want Aditya to give you a little bit more color of the intervention we are going to do with all these 112 districts. Come on.
If you remember when the first COVID wave came, 50% of the people in the world who had died were above 60 years of age. At that time, there was no vaccine. There was nobody knew as yet understood what COVID was. And so senior citizens we knew were at most risk. So we focused on senior citizens and we basically provided 3 things for them. The first thing is education on COVID appropriate behavior. Now everyone talks about hand washing, social distancing, all that, and mask wearing. But you have to remember at that point, it hadn't yet reached the villages. These are not populations with Twitter and Facebook and WhatsApp. Right. So we had to go door to door to make sure that they did this and they understood it. They don't understand the difference between this and Kala Azar, this and TB. They don't understand all this, right? These are illiterate populations. First was that. The second main thing that we did was we connected them to basic services from government. Some people didn't get their pension, so their money was running out. Some people didn't get their food PDS supply, so we connected them to that. Some people were not hadn't been able to source their medicines, for example, because it's in the nearby town was also closed. So the government would make sure that was happening. So that was the second thing that we did, basic supplies, so they would stay alive. First is COVID appropriate, second is basic supplies. Third is quick referrals. Now you have to remember that quick referral. So as soon as you had fever or something, they could call up the local volunteer. The local volunteer had a direct connection to the district hospital, and immediately they would be admitted on a priority basis. The doctor would see them, telemedicine, anything you want, because we didn't want anyone to, pass away, because they would think it's just a fever, but it's not just a fever. It's very risky. Better to get a test, get the test, whatever is necessary. So the first intervention was COVID appropriate behavior. Second was material services, and third was health services. All three services volunteers were trained to give.
I think in this, it is actually, we have got now the support of several foundations, but most of them, I'm afraid to say, are global foundations. So these are the foreign foundations. So whether it is the Bill Gates and Melinda Foundation, whether it is the it is
Rockefeller,
Rockefeller, whether it is
Cisco.
several of these, yeah. Uh, so all of the top foundations, but I still feel the second thing is, okay, this is the positive. The second thing is that because of the focus which has been given by government, a lot of the public sector organizations have already also started working in these areas. So that's the other thing that we've been able to do. But I'm afraid to say that the not so good news is that I don't find enough of the look our Indian large companies coming in this space. And that's what I hope that when we are now, therefore, earlier we were not talking about so much, but okay, now in CII and all that, we have also put our people in the committees to look at this. We are also now talking to you. So hopefully, when a reputed journal like yours talks about it, people will read. So we are just making people more and more aware of it. And then, so we can't go and, push it beyond a point. They will spend that 2% CSR, but they will not spend it in these districts because, as I said, these districts have been
Tough.
forgotten by us. We never go. So where would a corporate spend? They would either spend somewhere if they have a plant around that area, or they come from a particular region and you find. So see, in India, there are lots of problems anywhere you can spend. But this is forgotten, and we cannot forget this. These are actually some of our girls. Huh? These are people who
50%
work
of
in
our
the
staff are girls.
foundation. Yeah, they
How
go
much
into
percent?
it.
50%, sir.
50%. Okay.
Yeah, yeah.
They
So,
go to the Naxal affected areas. I mean, this only you read Gadchiroli and
yeah,
Nandurbar and all that. You read only in the newspapers, but these people, they go there, they work there. So it's forgotten. That is the actually unfortunate part. That's why you
Don't
find all these issues coming up, these social issues. It's going to be more deeper now. It's not
Yeah,
as many
deeper.
as people. It will be more deeper now. So that's
Yeah.
what we're going to do. Today we can touch so many people, but I mean, these training and the educating is really tough. So for instance, I'll shift from education to health. In tribal health, we realize that maternal mortality, the infant mortality is a big challenge. So how do you ensure that you can reduce that? In these places, tribals, they don't even have hospitalized. When you have pregnancy, they will deliver anywhere, wherever they are in the home. So how do you ensure that pregnancy, the delivery takes place in a hospital? How do you ensure that there is regular checkups done? So it's quite a lot. How are we working with the village and health nutrition people? Also, another big focus for us has been about women. How do we work? How do we ensure that? So, I spoke about girls, for instance, the girl child, to ensure that, and especially during COVID, that's another big issue we found that the biggest sufferers are the girl child. So, what are we doing for that, Aditya? Maybe you should talk a little bit about girls during this period? Because we did a fair amount of study in that, yeah. Because that's also another interesting thing that we are doing for women. And I think if you were to meet some of them, I think you would feel really happy. So, Aditya, talk about that, please.
So basically, there are no jobs for rural women. If you go to a village, I can pass 10th standard, 12th standard, but मेरी शादी हो जाएगी पास वाले गांव से और फिर कोई मुझे छोड़ेगा नहीं. Even to go to the first of all, there are no jobs. You know, when you're talking about why CSR money is not coming here, there are no plants, there are no factories in the places where I'm working. I mean, the whole district will not have a single factory. Literally, it's like that. Right? The entire district will not have a factory. So no CSR money is going to come there. Why will it come there? You know, there's no the industries ministry doesn't exist there. It is really no incentives, nothing. So in these places, men don't have jobs. But what can men do? Men will go from there to urban areas in Bombay, Delhi. They will go and ride rickshaws. What will the women do? We are stuck there. Na? As women, they'll be stuck there. So what do? We actually think of them as one thing that's possible is digital careers. So can they actually, so we actually train them on being able to handle telecalling, inbound as well as outbound, courtesy, empathy-based calling, all that. Two, we train them on using a CRM and databases to be able to log what they're doing. And they provide services to the 6 different state governments in which we are working. So government wants to find out key, in fact, during the COVID time, government used them so much because the Orissa government said, all my people are sitting in Tamil Nadu and this thing. So one by one, these women called them and made sure that, what is the situation? We are providing 2,000 rupees. The trains are at this time. You can come back. The Madhya Pradesh government uses them, was rationalizing schools. And so did a feedback survey with all parents as to,
So it's like a
are you
rural call
happy?
center kind of thing.
Total. But for
Absolutely.
government, sir, for
Mm.
government, Mr.
For
Majumdar, the
government.
point is they're servicing because governments don't know how to listen to their
Mm.
communities, right? That's the main
Mm.
thing. Whereas these women are listening and they are from the same community, they from the
Community.
same district, they are from with the same language, So we have language abilities in Bhojpuri. Very few people have a
Mm.
Bhojpuri call center.
Mm.
We have a call center which operates in Bhojpuri, in Gujarati, in Marwadi. And so when a local person calls, it seems like, acha, baju wale gaon se aap phone kar
Mm.
rahe hain. So I trust you and I'll provide the data. And it
True.
provides the women also jobs. We have 180
Mm.
women who are
See,
doing this
that's
across
the
India.
beauty. This
Mm.
serves a need, and if you look at the women, they feel so empowered.
Mm.
Many of them have never gone out of their house.
Right.
Here they're going out of a house, they are working on the computer. That's
Mm.
a big deal. And then they are satisfying a need. So I can say that, and they are they're also earning something. I think in some ways, globally, the stronger companies are only becoming stronger. And the amount of money that's thrown into the system, that's why you get valuations of $2 trillion. It's almost one company is nearing the GDP of India. I mean, this is not, but even in India, you're seeing that valuations are going up. Some businesses are doing pretty well, but I think in the second quarter or in this quarter results for the first quarter, you will find that there is going to be some slowdown as far as consumer demand is concerned. So consumer demand, I feel, is not as robust as it was, but production, the supply is better now than it was in the last year, same time. So